from your mic. So when we get going, you may just have to lean in a little more. Yeah. Thank you, Heather.
Okay.
All right, Megan, are we good to go? I'm seeing YouTube. Do I need to see the little recording symbol?
You are recording and you are live, and I think everyone is in now.
Perfect. Well, thank you and welcome to the North Central Regional Report Out call. This is the first of these that will be weekly at the same time, broadcast live onto YouTube at 2:30 every Tuesday. You can also go to the website set up by the state, which is covid.ks.gov/report-outs. That's covid.ks.gov/report-outs. You can sign up for an email to come to you after each of these posts with the dashboards available. They'll also be available on the website, but if you'd like them to be pushed into your inbox so that you can catch these on your own time, that is available. This was set up with the bequest of Governor Kelly and Speaker Reichman and Senate President Masterson, with the intention to get information out in the sense of regions. Healthcare systems move regionally, and right now you can get information on what's going on in the state of Kansas or your particular county. And what we're trying to do is give you an idea of how your region is doing, the hospitals near you, the public health near you, and to help you really have an idea of what's going on. We will not be prescriptive. We're not going to suggest what any elected officials should do or anything like that. We just want to get information out. And this is really intended for an audience that's very broad, elected officials who have to make decisions based on information around the pandemic, but also business leaders or community leaders or church leaders, or parents trying to figure out what they want to do with their kids, or people caring for the elderly population or older adults. We want to get this out. We'll start every call with an update from public health, testing what's going on there with positivity rates and the trends of number of cases. All that feeds into what happens in our hospitals. We usually see 3 or 4 week as we see cases spike. Then the following weeks we see it come into the hospitals, and so we'll get an update from the hospital system. This week, everybody I've asked on very short time notice to prepare for this meeting. We're building this airplane as we fly it, so to speak. Stood it up very quickly, but we want to start getting information out to everybody. So I thank you, everybody, for stepping into a situation as quickly as you have. Next week, we'll have a dashboard from KDHE that's regional rates, and we'll also have some additional dashboard from Mission Control, which is the software that many of the hospitals are using for transfer as a transfer portal as they're trying to move patients around. And we'll have them on our calls next week to provide some color around that. I'll also end each call with a bright spot. These are pretty heavy calls with the information that we're sharing, and just want to remind people that every day we have a choice that we can lean into this uncertain time and try and bring a little light into the world. And so we're trying to catch someone in your region doing something right. If you have a story that you'd like to share, you can email it to us at ksregionalreport@gmail.com, ksregionalreport@gmail.com. That's also how we're doing Q&A. We don't have time to do live Q&A on these calls, as we're trying to keep them to 15 to 30 minutes. We'll take your questions and try and incorporate them into next week's call. So just make sure you're tell us that you're talking about the North Central region of the state, and we'll make sure it gets onto this call. ksregionalreport@gmail.com. Okay, there's a little setup as we're laying the foundation this week. I'd like to turn it over into public health. Let's see, who's going to be covering that for us here? Is that Carrie Ann?
Yep, that's me.
Yeah, so Carrie Ann, I don't know if you have opportunity to do video. We can't see it, but if we can just hear you, that'd be okay too.
Yeah, my video is not working today, so.
No problem, go ahead.
Since I talked to you late in the day yesterday, and I had a mass testing clinic here in Ellsworth County that I coordinated for this morning, I have not had much time to prep anything for our region, so I apologize for that. I can tell you from Ellsworth standpoint, our numbers just keep climbing by leaps and bounds. So that was the purpose behind our mass testing, we collaborated with our local Ellsworth County Medical Center. They helped out this morning with that mass testing. We're doing it today, tomorrow, Thursday, and then again next Monday. Try to catch as many of those positive cases out there. Hopefully try to slow the spread in our county at least. We have our main 2 spots in Ellsworth County that we're doing testing is Ellsworth County Medical Center. And then we are doing testing here at our health department. We have rapid antigen cards that we're using from the state. We also are doing the saliva test through the Kansas initiative that they had set up with. We are using the CRL laboratory for those. And then we also send specimens to the state swabs. So I feel like we have a good resource for testing. One of the unique things for us is we do have a state correctional facility in our county, which does cause our numbers to look higher for percentage positivity than we would probably if we were just looking at residents. But that's pretty well what I have. I know just talking to other administrators around our region, I think everybody's in the same boat. Our numbers just keep going up and we're just waiting to get on the other downhill slides. So yeah, get these things evened out and a little bit more controllable for us. So.
Thank you, Carrie Ann. And like she said, we caught up with each other just last night, and man, the people in public health and in the hospitals are working so hard right now. So just carving out the time to be on this call to give us the perspective from Ellsworth. If people look at the dashboards attached that's put together with the Hospital Association, you'll see the weekly rate there of new cases. And really starting in the beginning of November, that went up from about 250 cases the last week of October to 589 to by the end of November, 1,000 new cases. And we've been between 900 and 1,100 new cases a week for the trailing last 4 weeks. And so that's the spike she's talking about, late October for the region, 250 new cases a week, to really a month later to over 1,000. And that, as it trails, like I said, begins to put pressure on the hospital system. And so I want to pass it over to Heather to see if she can help give us a perspective from what's going on from the hospital side of things.
Sure. Thanks, John. And I'll be brief because we do have Dr. Rob Freelove from Salina Regional on as well to give us more clinical information from the hospital and that type of thing. But as John mentioned, our cases have continued to increase here in the North Central region. We are at 1,040 cases this week, which is about a 10% increase over the last couple weeks. We're also seeing with the ICU beds, we have 39% of ICU beds that are available in the region right now. And we don't have a large amount of beds to begin with in this region.
Yeah, that number, it would be 11 beds, which represents 39% of the total beds, which is probably the most capacity I've seen so far today out of the 4 calls that I've done.
Yeah, and as others have mentioned on the calls earlier today too, that number can change, hour to hour, minute by minute, just kind of depending on what's going on with that situation. But staffing continues to be a huge challenge right now. 75% of our hospitals noted that staffing was their biggest issue, whether they have staff out on quarantine or staff that are positive with COVID or dealing with family members, that type of thing as well. And I did want to mention on visitor policies, I think some of the earlier folks talked about that as well, but only 21% of our folks in our area are allowing visitors in the emergency department and 25% allowing visitors for inpatients. So just if you do have to go, just know that there might be some obstacles there as well and some different things that you'll have to deal with. So want to turn it over now to Dr. Rob Freelove, who's the Chief Medical Officer at Salina Regional, and get his perspective.
Yeah, and in each call, we're trying to make sure we get someone who's boots on the ground to be able to to paint a picture. We can push dashboards out. If that was all it was, we could do that with an email. Carrie Ann and Heather and Dr. Freelove are helping provide the color of the reality, which helps translate it for people like me who aren't in the healthcare industry, and I'm sure with a lot of the listeners here. Dr. Freelove, are you able to unmute yourself and share with us? So you may be tending to a patient right now.
Apparently. How about now?
There you go. Yep.
Okay. Yeah, so I guess I won't necessarily throw any more numbers out at you, other than, we had 34 inpatients, which included 2 people boarding in the ER. I mean, I think we're experiencing the same thing everybody else is in that we're just struggling to find beds, and a lot of that is staffing. I know a lot of the smaller regional hospitals have really stepped up and are keeping some patients that I think initially when all this started back in the spring, a lot of people thought, well, we'll just send everything out. There's nowhere to send them. So a lot of the smaller hospitals have really stepped up and are doing more than their fair share of keeping a lot of those patients at their facility, which some of that's probably out of no other options, to be completely honest. But some of that is, again, just trying to keep people close to home and doing their part so that there is a bed when they have a patient come in who needs a higher level of care. And that's our biggest issue. I mean, we'd love to take more patients and provide that relief for our regional hospitals, but it's hard. I mean, the hard part is not just the volume of patients coming in who have it, but the length of stay and how hard it is to get those patients back out. I mean, we talk twice a week about our extended length of stay patients, and easily half of those, or if not more, are COVID patients, and it's just people who we can't get off oxygen and can't get them home, or can't find placement because a long-term care facility had an outbreak and they had to shut down taking new patients. The other thing that we've seen in the last 2 weeks, especially last week, is we've had kind of a spike in deaths, COVID-related deaths. We knew that would come sooner or later. It tends to follow the spike in hospitalizations by about a week or two, and that was our experience as well. I want to say, I know we had a 2-day stretch where we had 8 patients die in our ICU, which that's hard. That's hard on staff. It's hard on doctors. It's hard on everybody to have that kind of death rate, or just that many happen within that short of a time frame is pretty tough on staff. Especially when that opens a bed and we fill it right back up. It's one thing to go through that and maybe have a little bit of time to recover and reflect and try to pull things together. But when you take that person, the deceased person out, and 30 minutes later there's somebody else in that bed who's on a ventilator and headed in the same direction, that wears on our nursing staff especially pretty heavily. So that's kind of what we've been facing here in the last couple of weeks.
Thank you, Dr. Freelove. And if I could actually expand on just one thing you said, when you talk about the difficulty of finding beds, can you just give us a little color around what a transfer process looks like for someone who's not used to a hospital situation?
Yeah, so like for us, it's somebody who's going to need a little bit higher level of care. So maybe it's somebody who needs ECMO, or especially that we may not have readily available. And generally we have, one of about 3 or 4 places that provides a higher level of care that we'll call. And usually that's you're able to place somebody within 1, maybe 2 phone calls. We're making 6, 7, 8 phone calls to different places looking for a bed for somebody who might need a little bit higher level of care. We've had to cross state lines a couple or 3 times to find that, and we've actually been getting calls ourselves and patients. I mean, we had a patient who came in from west of Liberal Kansas, which, I mean, we're not in that, that's not our referral region. We've had 2 or 3 patients who've come to us from down by the Oklahoma border, or I think even one who came to us from Oklahoma. So, you know, it's not just us, it's kind of the whole Midwest, but that's what it looks like right now is, you know, it's not a phone call or a couple of phone calls to find somewhere. It's 5, 6, 7 phone calls to try and find placement.
Yeah, we had a doctor from Lions speak on another call, and they'd tried for a whole night, and then the next morning before they were able to find a place, and the person ended up going to Topeka. And you know, what they were able to point out was the longer you wait as you're making these calls trying to find a bed, generally the patient's not getting the level of care that you'd hope for,
Right.
that they could get at that specialized hospital. Yeah, go ahead, Dr. Freeland.
We had a rough one last week where it was a relatively young person. I mean, in the 40s. I mean, 44 is pretty young to me right now, and it needed ECMO, and that's not something we provide. And it took 4 phone calls until we found somebody who thought they could do it, and then just the whole transfer process, and then they didn't have it, and then they did, and then they didn't. It took us about 8 hours, I think, to get that person transferred to get that therapeutic.
Yep. And ECMO is a medicine, or is that a treatment?
It's heart-lung bypass, basically. Yeah, this individual's lungs were just so bad that we couldn't really. We were struggling to oxygenate and causing a lot of barotrauma to the lungs, and she needed to be, or the patient needed to be put on heart-lung bypass, and that's not something we do here on a continuous basis. We do it for our heart surgeries, but we don't run that in our ICU or anything like that, unless it's to stabilize somebody to ship them somewhere where they have that therapeutic intervention more readily available.
Yeah, thank you. And another thing that is not heard or felt in a story like that is there's usually a waiting room with some family members or on the other side of a phone wanting their loved one to get somewhere where they can get the treatment. And they're having to wait 8 hours in that limbo also. Yeah. Which takes a toll on the people that are communicating with them. I've been listening on some hospital calls as they've been communicating, and the burnout and the kind of emotional trauma is real, as you talk about, seeing a higher number than usual deaths in a week in an ICU. That really tends to wear on people. So, you know, we want to do everything we can to support you all and what you're doing, and just appreciate the care that you're giving out there.
Thank you.
And thank you for being vulnerable and sharing what's going on the ground there in Salina. I'll add, we've been hearing we started with Kansas City and then South Central, which is Wichita, just wrapped up Topeka. For consistently, just this idea that hospitals are closer to the edge than they've ever been, and having more difficulty as patients need additional care, finding them the beds and all that. And so that's part of the reason these report outs were started, so you can follow week to week and see what's going on, and then we can have an idea where things are at, and just get that out into the regions as people are listening. Heather, is there anything you'd want to add to any of that?
I don't think so. I mean, just as Dr. Freelove said, the transfers are difficult right now, especially from the smaller hospitals. So hopefully the Mission Control app can help with some of that. We've got, at least 8 members that are starting to work with that a little bit and have noticed some improvements there. So look forward to working with that more.
Yeah, and something you mentioned earlier too, I'll just highlight while we have just a little bit of time. The critical access hospitals, which are 25 beds or less typically, generally are not supposed to keep patients longer than 96 hours. And that's been waived during the middle of the pandemic, but you're talking about them doing things that are out of the ordinary for themselves. I've just been amazed to see at all levels hospitals trying to step up to create capacity and do what they can. And generally when our hospitals are running trouble, it's in one of 3 categories. It's stuff, it's staff, or it's space. Stuff was the main issue in April. Staffing has certainly been probably the most critical issue, even though there has been issues around stuff and space in different areas. So we'll be following that. You can see the percentage of hospitals in your region that are expecting staffing shortages in the coming week, and follow the beds being available. Now that all that changes, it's very dynamic, but we're able to give you a snapshot in time. And I want to give Carrie Ann an opportunity if there's anything you'd want to add to the conversation before I give it a wrap up.
I don't think so. Not off the top of my head.
Okay, Carrie Ann, Heather, Dr. Freelove, thank you for all you guys are doing. I know you're very busy right now in the middle of this, so to give your time up, to give a report out to your neighbors in your region is very important. Let me end on the bright spot note, and I'll say again, if you have a bright spot you want to share from your region, please email it in to that email address I shared earlier, and I got it here under a stack of papers. It's ksregionalreport@gmail.com, ksregionalreport@gmail.com. Also, any questions that you want us to try and address on the next call, just make sure you let us know. We're talking about the North Central region, and we'll do our best. We'll have a couple more dashboards available next week. We'll also be hearing from the folks at Mission Control what's going on as they see in the transfer processes. That's really becoming kind of a center point around the discussion. So I have two bright spots from this region. They're both really great stories. The first is a group in Abilene launched Project Ike. We like Ike. Project Ike, an effort to provide vitamins free of charge to all who need them with the goal of boosting the immune system of residents. That's a fun idea. I hadn't heard that anywhere else, but Project Ike there in Abilene, thank you for what you're doing. And then the other bright spot story I have from the North Central region here is the Irish Den Coffee Shop in Chapman. The Irish Den Coffee Shop in Chapman is creating a heated outdoor space for young people to socialize safely through the winter, thus reducing the spread of the virus during the winter months. So just trying to find ways to keep people from gathering indoors. A local coffee shop in Chapman trying to find a place for people to gather. So again, the idea with the bright spots, there's a lot that's out of our control, and you can feel powerless, but each of us has the power to try and bring a little more kindness and light into our hometowns and into the lives around us. And so we just want to highlight those opportunities. So thank you everybody for joining this call. Again, we'll try and keep them between 15 and 25 minutes full of information that hopefully is valuable to you as you try and get a picture of what's going on with the healthcare system in your region. Feel free to sign up for the email blast. If you think there's other people who find this useful, make sure you share it with them. Everybody, thank you for joining the call today, and we'll see you this time next week.